Good evening. Assalamu alaikum to all. Hoping all are well and doing practice. And there's a diet 2 and diet 3 already. Diet 2 completed and starting the diet 3 Kenya ended. So basically, the aim of the this session mainly that diet 3 fully changes, right? Long case, clinical communication. But yes, first the diet till diet 2, there is a examiner question, lots of question marking on their hand. Really, it is difficult. The assessment, examiner to examiner, really is vary because the numbering on their hand, how they are assessing your confidence, your communication, everything is vary examiner to examiner. So sometimes communication basically many candidates, my lots of friend colleagues get really very low mark in concern communication. So fluently practice is more important, and another important is the structure of the long case, structure of the communication, even in the clinical. If we do practice structure, why you must pass. That's the main point, to learn that how to pass in first attempt. If you follow structure, inshallah no one will fail, because structure without, if you anyone don't touch the structure like concern, judgment, what they're asking, even you don't have time, bell is running, but if you answer at a time one word, that's the marking. That's why each point is very important. So two candidates messaged me for the today mock session wise discussion, and we'll start recent diet in 2023, what is ongoing, the diet case wise discussion. So Dr. Sumbul is here.
Yes, doctor. Assalamu alaikum.
Dr. Sumbul will participate long case discussion. Okay. So long case, before starting, same structure wise. The timing will be, I'll give only 12 minutes in details, because the issue is that whenever in real exam, few timing lost, like you enter and you're seeing something ongoing, so 2 minutes or 1 minute, really in real exam it lost. So better to be fluent structure wise. If we do practice, inshallah all will pass. So I'll give Dr. Sombul 12 minutes and 4 minute discussion or examiner question wise. So Dr. Sombul, your case is start from this and time only 3 minutes.
Okay, thank you.
Dr. Sumbul, start.
Hello, my name is Dr. Maiman. Are you Mr. Jackson, son of Edna Richards?
Yes, doctor, I am.
Can you please confirm her age?
Yes, my father, Mr. Richards, age is 55.
Okay. Mr. Jackson, I'm one of the doctors in the clinic today, and I've been asked to talk about your condition, father's condition, also examine him. Is that okay with you?
Yes, doctor, it's fine.
Okay, so Mr. Jackson, can you please tell me why are you here today?
Yes, doctor, actually, I just came from India right now, and my father lives alone. And when I came back from India, my father complaining that he's feeling dizzy around 7 to 8 days more, but he was feeling dizzy before that as well, but now it increasing. That is my concern because my father lives alone.
Okay, I'm really sorry to hear about that. I'll try my best to sort this out and guide you and your father accordingly. Is that okay with you?
Yes, doctor, it's fine for me.
Before I proceed further, Mr. Jackson, I'm going to write down some notes and assure you they will remain confidential in your father and you will have my entire attention. Is that okay with you?
It's okay, doctor.
Okay. So, Mr. Jackson, like you said that your father is feeling dizzy for past 1 month. So, how did that exactly start, the first episode?
Yes, doctor. My father said that it started this dizzy feeling gradually, but now it's more. I mean, my father always tried to relieve from this dizzy, and always I saw that I noticed my father always tried to uh, feel like dizzy and try to sit down whenever he tried to any doing work. He feeling dizzy and he sat down at intestinally. So it's always nowadays, but before that it was just 1 or 2 times.
It was 1 or 2 times. Okay. Can you notice anything that makes this dizziness worse other than standing?
Yes, doctor. Like whenever my father tried to do any work, it is more worsening.
Tried anything to make this dizziness better?
As I said that always he tried to sit down and he tried to relieve whenever it is like lie down, sit down, he tried to get relief, but somehow it is not relieving.
Okay. Okay. At any point, did he lose any consciousness?
My father said he still didn't lose any time consciousness, but it goes towards that he may lose, but no, still not. But I was not there. My father complained
Okay.
that he was
Okay. Okay.
episodes of
Okay.
lost for short time.
Okay.
Yes.
Okay. Did your father had any kind of trauma to his head?
Yes, as I said that one episode it happened. I was not there. So he said that he just fall down on the table and it was trauma in the head.
Okay. And it was before this dizziness started or after this dizziness started?
He said that he tried to stable himself by catching something, but he fall down, and that's it.
Okay. Okay. Did he have any headache before or
No,
after this dizziness?
no,
Okay. Did he have any eye problem?
no.
Did he? Okay. Any racing of heartbeat?
When, doctor?
Did he have any pacing of heartbeat?
He complaining of the racing of the heartbeat.
Okay. Since how long he has been complaining about this?
Actually, he said that it's worsening whenever he fall down, but it is not falling down. He seems like that. That's at the time he feels that there is some racing of the heartbeat and it stopped itself. That's it.
Okay. Is it regular? Is it irregular? Do you have any idea about that?
No, my father didn't appreciate any type of the regularity or irregularity.
Okay. Okay. Did he have any raised temperature
No,
and lumps or bumps on the body?
no, doctor. You can check.
Any feeling of?
Actually, I was not there, and my father is also
Okay.
not appreciated.
Okay, during these episodes, any feeling of throwing up, or has he actually thrown up?
No, doctor.
How are his water works?
It is fine.
How are his bowel works?
It's also fine.
Okay, any back pain that your father has?
No, doctor.
Any neck pain?
No, doctor.
Any weakness of his arms or legs?
No, doctor.
Any weakness on his face?
No, doctor.
Any shakiness of his body?
No, doctor.
Okay, any weakness of his any difficulty in hearing?
No, doctor.
Any problem with his taste or smell?
No, doctor.
Can he walk properly?
Yes, he can.
Okay, any tingling, numbness sensation of his arms or legs?
No, doctor.
Okay, does he feel like he's walking on a cotton wool?
Sometimes my father telling that I feel some cottonwool walking, but actually he's on diabetic, and we already taking care of the diabetic clinic, and our GP doctor said that it is due to uncontrolled diabetes.
Okay, so his diabetes is uncontrolled. Okay, and has he noticed any chest pain?
Chest pain, no.
Any breathlessness?
No, doctor.
Any cough?
No, doctor.
Any swelling around his eyes or on his legs?
No, doctor.
Does he feel any pain when he walks?
No, doctor.
Okay, any preference to any temperatures?
No, doctor.
Any darkening of his skin?
A darkening of skin, no, doctor.
Okay, any bluish spots on his body?
Blue spots, no, doctor.
Okay, how is his weight?
My father weight is okay. It's within normal still. There's no
Okay, how is
changes.
his appetite? Okay,
Yes,
how is his appetite?
there's no complaining of any appetite changes.
Okay, your father's notes say that he has high blood pressure and high sugar. Since how long he has been having these?
The high blood sugar around 10 years, and as it is uncontrolled, my father actually businessman, and the blood pressure is only for 3 years.
Okay, so is he taking any medications for both of them?
Yes, doctor.
What medications?
For the diabetes, my father taking some drugs. It is called sitagliptin, twice time daily, and insulin at the night time.
Okay, okay. Is he complying to the medication?
Recently, as my father is not feeling good and trying to do complain about that, but I'm afraid of that, how he's correlate on those medication, because sometimes maybe he's forgetting.
Okay, okay. What is his last 3 monthly sugar test?
Yes, my father said it was 9.
It was 9. Okay, okay. Has your father been compliant to the diet as well?
Yes, he's on control of the diet, doctor.
Okay, okay. Does he exercise?
He tried to do so, doctor.
Okay. Any medication that he takes for his high blood pressure?
Yes, doctor.
Okay. Which medication? Can you please tell me the name?
It is called Ramipril, and another name recently it is told that some bisoprolol like that. You can check my medication list. The medication list is written that bisoprolol plus and Ramipril.
Sorry, what
5
the name
milligram.
is?
You can see the checklist of the medication list on the hand of the son, and it is that bisoprolol plus and Ramipril 5 milligram on the hand medication note.
Okay. 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 Right. Mr. Jackson, is your father in check with his sugar and eye doctor and heart doctor?
Doctor, yes, my father is regular on checkup. Last 1 month, as due to this dizzy feeling, he is really very difficult to go and visit on them.
Okay. Okay. Any long-standing illnesses in the family that I should be aware of?
No, doctor.
Okay. Does your father smoke?
Yes, doctor.
Okay. For how long he has been doing it, and how much in a day does he take it?
Around you can say he's a smoker 10 years, and per day he's taking 4 to 5 cigarettes.
Okay. I would advise your father to stop smoking. That is injurious to health and can have bad consequences. I'm going to refer him to a smoking cessation clinic. Is that okay with you?
Yes, doctor. I'll talk
Okay.
with
Father
my
drink
father.
alcohol?
No, doctor.
Okay. Does he drink alcohol? Okay. Okay. Has he recently traveled anywhere?
No, doctor.
Does your father drive?
Yes, doctor.
Okay. Mr. Jackson, I would advise your father to stop driving and inform DVL about it till this problem gets sorted out. Is that okay with you?
Yes, doctor.
Okay. Is your father in check with the vaccinations?
Yes, 2 minutes left. Yes, my father
Okay. I would
completed
like
the
to examine the
vaccination.
patient now. First, I would like to check the pulse of the patient if it's regular, and then I would compare it with the other hand. I would like to see the nails of the patient for any palate that might be present for polynechia. Then I would like to see the eyes of the patient for again any palate. I would like to see for if there is any proptosis present. I would like to see the mouth for again palate, and then I would like to see the neck for any swelling that might be there. And then I would like to also check the blood pressure lying and standing in this patient. Okay, and I would like to check inside the mouth any pigmentation that might be present in this patient. And other than that, I would like to see, I would like to check the legs of the patient for sensory neuropathy. First, I would like to see the pinprick mark. Then I would like to see through the cotton wool. And after that, I will do proprioception. And then I would like to see the direction sense. And I would like to ask the concerns. What are your concerns for me, Mr. Jackson?
Doctor, my concern is that my father has pacemaker 1 year back, and my father afraid of that it is due to again need new pacemaker or not.
Okay, right. Okay, Mr. Jackson, I appreciate your concern. On the basis of just the examination finding anything positive?
The positive, no, all are negative, and there is a posture, there's no posture drop, and there is in exposure of the patient, you can see the patient's neck side.
Okay, okay, right. So, Mr. Jackson, on the basis of what you have told me, what I examined you, I have few differentials in my mind. Topmost being, as you already have a pacemaker in your heart, and you have already had a rhythm problem. So, what I would like to, it's a possibility that you might again be having a rhythm problem, which is why you have been feeling dizzy. What I would like to do is I'm going to
So
involve
my
a
father
heart
need new
doctor.
pacemaker, doctor?
Well, it depends. First, I would like to do a tracing of your heart and see if the pacemaker is in place, if there is any lead problem that might be there. There's also a possibility that your father has diabetes and high blood sugar level, and as it is uncontrolled, one of the possibilities, sometimes the body nerves get desensitized and can cause this dizziness as well. So I would also involve the sugar doctor so that your father's sugar can get controlled, and basically a multidisciplinary team would be formed, which would involve
Time
a
is
heart
up.
doctor. Okay.
So, doctor, 1 minute I'm giving. You can summarize yourself in taking time. So, doctor, can you tell me what are the positive findings in your case?
So, Mr. Jackson brought his father, Edna Richards, 55 years old, with a complaint of dizziness for past 1 month. Intensity has been increasing in last days. In the history, I just got to know that patient has been having palpitations, and he also has history of trauma because of this dizziness. He is known hypertensive diabetic. His diabetes is uncontrolled currently, and he apparently also had surgery, pacemaker placed. On examination, I could not have any positive findings. Yes.
So, doctor, can you tell me what are the differential or you have diagnosis of this case?
So I have two differentials in my mind. First and foremost would be arrhythmia, as patient already has pacemaker placed. It's a possibility that during this dizziness spells, patient may have this lead displaced, or patient may be having pacemaker syndrome, which is why he's been having dizziness. Another one is autonomic neuropathy secondary to uncontrolled diabetes.
So, doctor, could you tell me what you preferable investigation in case in your patient most appropriately?
Most appropriately, first and foremost, I would like to do ECG tracing of this patient to look for any arrhythmias that might be present, and then I would like to do the echo of this patient, as he hypertensive diabetic can have heart disease. Another would be if patient is having ongoing on and off episodes, then Holter monitoring would be one of the investigations as well. And other would be I would like to monitor patients' blood sugar levels, urine dipstick, and HbA1c again. And yes, these would be the most appropriate ones.
Do your patient need admission, doctor?
Yes, patient needs admission, as his episodes have recently increased, and again, I'm as expecting any problem with his pacemaker.
So if I want to say what will be top differential in your case?
Top would be arrhythmia, secondary to any pacemaker abnormality.
So how will you manage this case apart from admission? Anything else?
So I would like to form a multidisciplinary team in this patient. After being admitted, I would involve a a cardiologist, a heart doctor. I would involve a diabetologist. I would involve a nerve doctor, and depending on the cause, I'm going to treat this patient. If patient has any problem with the pacemaker, then pacemaker probably we will need lead adjustment. If patient has uncontrolled diabetes, the dose adjustment would be needed in this patient. And yes.
Thank you, doctor. Time is up. So, Dr. Sumbul, overall you did well. Basically, this was diet to India Center scenario, and there is a lot of twisted was there, and due to timing, there's no chance of taking the history. But overall, if the same scenario they keep as a long case, there is a sequence organization what Dr. Sumbul missed. So I want to, before analysis of complaint, I want to say that any dizzy feeling, first ask what do you mean by dizzy. Even some must to ask any hunger pain, anyone checked sugar level? As I said, the frequently it raises that which time of the day more. What about at the time of the diabetes? As there is a most important point was uncontrolled diabetes, pacemaker, both was very important. So evaluation, main structure wise, if you not proceed, you lose the case and you'll get 0. I mean unsatisfactory. And they will not even their hand not will be any shaking. They'll just mark as unsatisfactory. That is real exam scenario. So that organization of history taking, and at the end, I mean just ending the time, examination starting, that means we need more practice, right? We need more practice talking and doing the examination. Because dizzy feeling at a glance, it could be syncope, vertigo, epilepsy, whatever. Shaking, she asked, but in details before what happened, sweating, any pain, any kind of the cough there, any kind of the racing of the heart. Yes, asked, but correlation, how it ended, is it spontaneously, what he was doing at the time. I mean, he need any kind of the sugary food, sugary substance to resolve this kind of the episodes. Any color changes, I say 2 times or 1 episode fall down. If you need evaluation, I totally give you 14 minutes, because I'm saying that you are still didn't started the examinations. That's why I given more than 2 minutes that to complete the structure, the history taking structure complete, and the concern very late, even very afraid that it's really pathetic if anyone fail for 1 mark in the concern. Really, it is not accepted. Even myself, I said it's really pathetic. So concern. In the meanwhile, is there any concern? I understand that is sympathy. Even if you have to show this, yes, it's long case, but sympathy is very important. Second is that after that, yes, ask that weakness, how long speed was recovery time is important, time of the speedy recovery, it is important. Even a past history apart from diabetes, high blood pressure, any other procedure, any other surgery. If you don't ask, I'll never say, I'll never. You must just ask me. Any procedure, any surgery, any kind of the before admission of the hospital, even if any word, if doctor asks me that any one episode of the admission of the hospital, I said yes, there is a 1 year back, there is a pacemaker implantation. Another information of patient pacemakers reschedule, I mean rechecked 6 months ago, but somehow he fall down and it displaced. That was the main scenario of the exam. So my doctors, we are practicing a lot, but somehow 1.2 point is the cause of the failing is really pathetic. So I want to say a few words for this question regarding the dizziness, as it is a broad. So the peripheral, it could be benign positional vertigo, it could be any kind of the labyrinthitis, vestibular neuritis, like acoustic neuroma. These are the peripheral causes. Central, any neurological. Doctor was examination. Yes, cortical. The examination skill. Dr. Sumbul didn't examine oscul the heart, didn't palpate the peripheral artery. Very vital, very much vital. Auscultation, palpation of the artery, very much vital. Shaking of the carotid, auscultation of the carotid, is there any stenosis, aortic stenosis, carotid artery, breathe there. So vital. So examination skill will be the unsatisfactory. This is the real exam pattern of the judgment. So central, it could be due to postural hypertension, recent drug changes. I said that recent drug changes of the antihypertensive. So 3 differential. The bisoprolol plus means recently added hydrochlorothiazide. So it could be one of the causes. We should review the whole of the medication. We have to inform the cardiac team. So whenever you have to tell the examiner, you have to be very fluent. What? Non-pharmacology, pharmacy. If you don't utter non-pharmacology, tell. I have to give the support of the care, like the medical admission team. We have to start the full evaluation, even 24-hour Holter monitoring. Didn't say specifically this question was asked by the examiner. What is the specific or most appropriate investigation you will do? If you don't say 24-hour Holter, they will cut down and unsatisfactory. So this is the real case. So patient education counseling, patient need evaluation fully, patient need admission. So this blood pressure reading, what was given is real exam case blood pressure reading was given, and some candidates just think it is a postural hypertension. Actually, no, there's no postural hypertension. So it's a normal, but you have to measure sitting and standing both way. So these are the causes and the dizziness analysis first time. So is it first episode or it just happened before dizzy feeling? Duration, obviously the duration, how long it persists. How long it persists is a very important question we need to ask. Dizziness lasting less than a minute. It could be pre-syncope, lasting minute to a few hours, labyrinthitis, vestibular neuritis, prolonged time. It could be any kind of the stroke or multiple sclerosis. Though ask me that any weakness there, any. So evaluation cardiac, neurological, and metabolic, diabetic. 3 must. So whenever we'll enter in the exam hall, we need to do a structure. What I will do? It is my real patient. What I will do? Practice this way. Because we are spending our money, our energy, everything, right? So it's really vital to do so. Do structure. Cardiac, neurological, metabolic, what I'll do. Because 15-minute time really sounds good to do so. Okay. And the precipitating factor, there is a viral kind of the infection. Doctor said, ask me any trauma. Yes, ask me. Any coughing, sneezing. They didn't ask any kind of the cough association, syncope, pre-syncope evaluation. So these are the cases that we need to do structure-wise practice. So the communication skill was need to more organized. Physical examination was very lately started. Examination finding, there is a yes finding was there. There is a pacemaker. There need to do pulpit. Okay, so there's a finding was there. So it will be the uncertainty if you say no finding. Clinical judgment, even cotton sport. There's I didn't see any finding. Second, clinical judgment. Clinical judgment, I said, is it needed? Yes. Doctor said, yes, it depends. Because we have to meet a multidisciplinary group of the doctor cardiac team, and they'll evaluate the further. And after that, we'll reach our plan of management. Concern, yes, try to meet, but I have lots of concern actually. 2 to 3 concern was there. And patient welfare, yes, it depends according to real cases, and differential was missed. There is also recent changes of the antihypertensive was one of the another differential. So this is the structure we need to do practice. So another, the communication case, my doctor's was name actually I forget, who messaged me from the UK center, Dr. anyone, or who messaged me at the morning can unmute the mic for these cases.
Dr. Irene, what was the diagnosis in this case?
Dr. Dinusha. There's no diagnosis, there's a differential, 3 differential. Even the feedback was 3 differential. Pacemaker, implantation, it was the misleading, or the lead was displacement. Second was diabetic neuropathy. And third was autonomic neuropathy and the hypertensive changes, 3.
Excuse me, can you share the previous slide?
Yes, sure. Dr. Dilruba something now, I forget actually. Dinusha something. If not, anyone can do this communication. If Dr. Dinusha is not here, anyone can raise hand for participation of this communication. Yes, Dr. Ibrahim. You can take 2 minutes, and after that we'll start this case for preparation. Start, doctor.
Hello, good morning, Mr. Seaman. I'm Dr. Ibrahim, one of the doctor in gastroenterology clinic. Nice to meet you. Can I confirm your name, please?
Yes, doctor. I'm Simon Sholish, 27-year-old, and my father is Mr. Alan Sholish.
Okay. I want to talk to you regarding your father' health and his current condition. It's okay with you?
Yes, doctor. Today, I'm here to see my father, but I don't know what is ongoing. And the nursing are frequently telling me that my father is not good. What happened to my father, actually? I'm very much worried. I was in Switzerland. Now I want to see my father, doctor.
Okay. Before I start to talk to you regarding the current health problem of your father, do you have idea about his disease or his
Yes, my
condition?
father is a known case of some lung problem. I know, but my father was fully okay over there because my father always check up of the lung clinic, and I don't know what happened. This my father was telling about 2 days ago that feeling of the fever is okay fine, and he was admitted. Now the nursing all are telling he's not good. Why, doctor?
Okay. Actually, your father is suffering from a disease in lung, and this it's a chronic disease, as you know, and as you mentioned. We're doing our best to treat the current condition, and this disease is a medical term for a medical condition named chronic obstructive pulmonary disease. It's a disease in the alveoli, and the father is admitted due to exacerbation of this disease. And there is many factors for exacerbation, can be infection, and this disease is able to be deteriorating with the time. Okay, so we do our best to treat this acute illness now, and actually we reach a level of your father is suffering from some disturbance in blood electrolyte, and the main one is the sodium level. We also we treat this the term of this one is hyponatremia, and we treat this level of sodium. But it's reached now يعني like we reach a level of this illness. It's needs some intervention. Are you with me?
What is intervention? What is electrolyte? I don't know what he was talking. I am not understanding.
Yeah, okay. As I told you, this a lung condition, and this a chronic disease, and now in acute exacerbation, like acute deterioration, and we trying to treat the current deterioration, and we need to do some intervention and to add a machine for your father
What is this, doctor?
to help him to breathe. It's it's a machine named BiPap. So this a ventilation machine to help your father to breathe and to maintain his oxygen level in his blood.
Okay, so
Are
my
you?
father will be on machine. So my father will be fully recovered if you give this machine, right? Okay, give it.
Yeah, for sure, for sure. It will help to maintain his oxygen level in blood, and for sure, this current condition will be better in the future. And he
Better in
need
the
to
future. I mean, still
uh,
you don't know what is ongoing my father, and everyone telling my father is not well, my father is deteriorating. What is talking about my father? Don't know, and you was telling that if this machine giving, my father will fully recover, so do so. Why are you asking? So just give this machine and recover my father from this deteriorating condition.
Yeah, don't worry. We will start to give this one. I want to explain to you more about this machine, and we will start to give it now. It's okay with you?
Yes, doctor, it's okay for me.
Okay. So it will be, there is a special setting for this machine, and under a special pressure. We will give it to your father for hours during the day. Maybe he need to discharge from hospital with this machine to help him to sleep at night. And we will train any family member to how to use this machine at home.
Okay, doctor, no problem. So
Okay.
my father will improve soon, right? I understand. It's a very good news. So all are telling lie, I think. Yes, you are very good doctor.
Okay, thank you very much.
So when you will give discharge my father, doctor?
The discharge, we will do a blood test to check his oxygen level in his blood. If everything is okay, we can discharge your father, and for outpatient follow-up with the chest doctor.
Doctor, very good news that my father will be improved soon. My father will go with me. It's really very good news. Okay, thank you, doctor. Okay.
Okay, welcome, welcome. Do you have any concerns?
Yes, my one concern that that is this machine what you are telling about. So is there any chance that in full life my father need to carry this machine?
Yeah, there is a portable machine. He can carry it everywhere, no problem.
Okay, understandable.
You asked me if it's portable machine or no?
No, I'm asking that if my father started this machine from in future, so will he will be fully dependent on that machine or not? I mean, it will need to carry all over the life. I mean, so.
Yeah. Actually, he reached, this disease, there is a stages for this disease. Your father he need this disease, this machine for life, actually, because he reached the last stage of his disease. So it will help him. It will maintain his blood gas and oxygen level.
Okay, doctor. Thank you.
Okay. Do you have any other concern?
2 minutes left. No.
Okay. Okay, thank you. Do you want to know anything else regarding his management?
No, really, it's a very good news for me today that you are telling my father will be improved soon and the machine will recover fully. It's really very good news, and that's it. And you teach my father how to use this machine. It really is a very good news for me.
Okay. What's your father work? Your father is working?
Yes, my father was businessman, but now he fully retired.
Okay, retired. There is any current smoking? He's a smoker now or no?
No, he was smoker, but recently stopped it.
Okay, so he's not smoking now. Okay, so thank you. That's it.
30 seconds remaining in your site.
Anyone to help your father at home?
My sister was there, and my sister, if need any help, so I need to take care about that.
Okay. Okay. I can discuss about this machine. If you need anyone to help your father at home to use this machine, we can
Okay.
talk to the social
Time is
worker.
up. Thank you, Dr.
Yeah,
Time
to
is.
provide
Yeah.
someone to help you.
That's Dr. Ibrahim was telling that she's first time, right? Today. She's
Really.
first time. You are telling, yeah, that's the point. That's the point. No problem. Not issue. First of all, Dr. Ibrahim, your scenario is fully missed, doctor. You said if you read completely, like in outside, there's a 5 minute. Even it is first time, no problem. But the issue is that his condition is not improving. His condition is not improving. And where is the LPA talking? Okay. And you are giving discharge, you are telling improving. So all are against my scenario. All are against my scenario. So these are type of the scenario coming nowadays. So that hyponatremia and lots of jargon there, my dear Dr. Ibrahim. Lots of jargon mean I was writing infection, electrolyte, hyponatremia, algal, lots and lots. So all in the layman term, soft level, right? Soft level, high there is some bug affection, right? So each word, really, it is really true. The examiner is so sharp, they are counting each word what you are telling, each word. That's the point. For dietary candidates, actually, so whatever you are uttering mean the counting, the marking, that's the point. So you utter one wrong word, they are writing it. That's the point. So fully the scenario was LPA, lasting power of attorney. There is a advanced directive, the condition, end of life care, okay, palliative management. So in totally this, it was not discussed by Dr. Ibrahim. So that first of all, we have to introduce ourselves. I'm Dr. something from the gastroenterology clinic, and I'm here for discuss for your further condition. Is that fine with you? Then start. It's a breaking bad news. It's a breaking bad. I'm frequently telling the nursing are telling, they are telling, I'm very afraid what is ongoing. So mean it is really breaking bad news. So you have to start very sympathy. Even some voice tone is important. So the communication skill deteriorating mark only for the voice tone. No need to be hurried, no need very cool, calm, confident way to show the examiner, the British examiner, whatever, wherever the exam, that you need to be very confident. So say, yeah, I understand it is very difficult time. It's not improving. The first, no need to discuss COPD because the patient's son already know that it's a COPD or something, lung disease, whatever. Now exacerbation is said due to the infection, but now condition is not good. So definition of type 2 respiratory failure mean what? Oxygen level in the body decreasing and increasing. That gas name is carbon dioxide, so that the breathing system is not properly working and your father is confused. It could be due to the low sodium, it's said here. So you can say it this way. And really we have tried our best in a maximum level to get up from your father from this condition. And our consultant, our team decided to start a machine. It is called BiPap. My concern is it fully curable? No. I understand how much you are worried about that, but the machine only give the support to reduce the level of the bad gas, that name is carbon dioxide, to improve the oxygenation of the body. What is the LP? Even know what about the LP from the Dr. Ibrahim side? So lasting power of attorney, any wish, any kind of the concern was there that for the last time, if it is ongoing, if not improving, there's some time of the legal issues there. Though in this dietary, no examiner crossing. It is not good point my side. Yes, some side is good, but all discussion will be there. My group, I already given some link, right? What actually do after you come out from the room. They discuss actually what you did. What you did, they discuss actually. So each point is important. Lasting power of attorney, is there any wish? Is there anything that your father say about that before? So there is we have to give the palliative. What is this manning of the palliative? The comfort of the as there's a breathing difficulty, we'll try our best to give the comfort, even if it is what the palliative pain control, breathing control. Okay, it is not a like palliative means maladies. No, it's the comfort of the patient's condition. So this is a very important nowadays, the questions asking. So these are the questions was there, the some concern was there. It was written so real scenario wise. Scoring will be the communication wise. The communication was haphazard. Dr. Ibrahim said it was first time, and the concern was lots of concern. Concern was actually real regarding the how long my father will survive, because if they didn't say the breaking of the bed news, there's no warning shot. There is no palliative management discussion, lasting power attorney discussion, so clinical judgment. So in details, score will not be good. Thank you, my doctors. Assalamu alaikum. We are ending my session. If any question, we can discuss. Any question?
Well,
Yes, doctor.
Doctor,
Yes.
I have a question. Because
Yes.
her condition was not improved, because she's on BiPap therapy, she got to respiratory failure on the going on. Should we discuss the palliative care?
Yes, palliative, yes, must, cause patients is not improving, palliative management will be there. It is not palliative Macmillan nurse, not. It is palliative mean improving the breathing system, improving the difficulty, improving the if any pain. So definition will be the, we are trying our best to comfort the condition of your father. Don't be worried, we are here to help. The LPA, Dr. Tota said, okay, I'm discussing. Dr. Yes, Samsunapo. So palliative definition, you have to say it is not improving. We started this machine. We're hoping that it will decrease this gas level. And if it is not, there is some condition, though we have to start and we have to start discussion, cause it could be. Because neither examiner, if they are analyzed in themselves that they didn't discuss regarding the palliative, it will be cut down the marks.
I asked because there is no clue about the palliative care, but but his condition is not good. That means we give the support by palliative means. So do you
Yes.
think that we'll say the palliative care, or we'll discuss the other things other than uttering the palliative care?
Uttering the palliative, we can say another way, because always try to be talent. How that now if my concern, because Dr. Who Ibrahim is only full mark will be lost, because if they say there's a, we can start this machine to improve the gas level from the body and to rush out the carbon dioxide level. But even if it is not improving, there is a care, it is called palliative. Indirectly, what is then the answer will be, what is that? Indirectly, if it is not improved, because this is my concern, it was my concern, is this machine will improve my father? Will my father will go back with my home? There's no concern was submitted by Dr. Ibrahim. So if they say, no, this machine we are giving only supportive to improve the body, bad blood condition, gas condition, improve this. If it's not improving, there's another management, it is called palliative. You can utter indirectly. That's why examiner will understand how you are dealing this kind of the critical patient.
Okay, thank you.
Doctor,
Yes, Dr. Omer.
I have a question, please. Regarding the management plan, can I explain which is the drugs, if we need to change the drugs he uses, because he has many exacerbations.
Yes.
Now he developed type 2 respiratory failure.
Yes.
This means
Yes,
he is
you
not
understand. Yes. Drugs actually here, mainly management will be doctor. BiPap description and palliative. This was the main issue. Palliative description indirectly. What we will do? The concern was two. I was written, if my father received this machine, will my father fully recovered or not? So if you say it depends. So if my father not improving, if still deteriorating, what you'll do? Then palliative. What is palliative? Then you have to add, it is a pain management, difficulty of breathing management, even need intubation. It according to your wise, like what is my concern? What is my question? You have to answer stepwise. No need to say it's a morphine, no need to say any medication, because we are starting antibiotics, the infection is there. As they said, only low sodium level, the salt level started the guiding, or already started the correction of the low salt level. So you can say this way, but the medication, already you can say like my time I said indirectly all question answer. So alhamdulillah all was full mark. So indirectly question answer, I always prefer that answer, but indirectly. What I do, I'll give this management. What is this? Like antibiotic has started, the medication of the correction of the infection is corrected, the breathing difficulty. So we started oxygen, supportive care. So always try, you are the safe doctor. Dr. Omer, clear?
Yes, okay.
Any question?
Dr. Irene, how to explain BiPap to the attendant?
Yes, that's the point. Dr. Ibrahim didn't explain. BiPap machine, actually, you have to say this is the machine which will attach with your father, which will wash out the bad oxygen. It is a device like a machine. This device actually do washing out the bad level of the gas. It is called carbon dioxide. That's it. No need to say anything else. So it's a device which will attach with your father to wash out the bad gas, carbon dioxide, and which will improve oxygenation of the body. And we are thinking that it will improve the oxygen level of your father.
Okay, thank
So
you.
thank you so much. Assalamu alaikum. Thank you all for attending the session.